Ujumbe wa wataalamu wa tiba kutoka Tanzania ukiongozwa na waratibu tiba kutoka Jumuiya ya Afrika Mashariki na Wizara ya Afya hivi karibuni walifanya ziara katika nchi za Afrika Mashariki zikiwemo Rwanda, Kenya, Uganda na Burundi kutangaza huduma za kibingwa zinazotolewa Tanzania. Baadhi ya vituo hivyo ni hospitali ya Benjamin Mkapa Dodoma iliyowakilishwa na mkurugenzi mtendaji Dr. Alphonse Chandika, madaktari bingwa wa magonjwa ya damu Dr. Stella na Dr. Shija. Hospitali imeanza kutoa matibabu ya kubadilisha urojo yaani bone marrow kwa wagonjwa wenye ugonjwa wa seliminde yaani saikoseli pamoja na upandikizaji wa figo. Wakati huo mwakilishi wa Chuo Kikuu cha Afya Muhimbili alisema chuo hicho kinaanzisha kituo cha Mvuto kwa tiba ya meno na kinywa. Akiwakaribisha wataalamu hao, balozi wa Tanzania nchini Burundi, Mheshimiwa Biakanwa alisema vituo vyetu inabidi vianze kutoa ufadhili kwa wanafunzi kutoka nchi mbalimbali Afrika ili kujitangaza zaidi. Aliongeza kuwa kwa kufanya hivyo inarahisisha sana kujulikana na inapotokea kuna hitaji la kutangaza huduma za kibingwa inakuwa rahisi maana tayari kunakuwa wanazifahamu taasisi hizo. Kwa upande wake, serikali ya Burundi, Katibu Mkuu Wizara ya Afya Burundi aliwakaribisha kwa furaha sana na kusema wamefurahishwa sana na fursa hizo ambapo wananchi wa Burundi watafaidika nazo.
So far about 80 to 9 months. I'm getting used now to Bujumbura and eat them quickly and the rest of the allow me also to, before I go to the formal introduction, to express my appreciation to the Minister of Health of Burundi, the government of Burundi, for indicating and promising to support Dr. Fosin, who is a candidate for the director of WHO in Africa. I am told you speak a little Swahili. Okay, but you can mix. You can go to switch. The relationship between Tanzania and Burundi is very strong. It is more diplomatic. We are more a family. We have a lot of intermarriages between the Tanzanians and the Burundians. Sometimes it takes me difficulty to identify who is a Burundian and who is a Tanzanian when it comes to those who
are the same people.
Yeah.
I know that Tanzanians speak Burundi very well at Kigoma.
Yes.
And some Burundians speak good Swahili as well. And better than in the Swahili of Tanzania. Though when you meet them, they will say my Swahili is very poor, but when you listen to them,
but the Swahili of Tanzania is the best.
Okay. You also speak, it looks like you could speak good Swahili.
Some words only.
Okay. So allow me to introduce the team, and after I introduce the team, I will present a little gift with me. This is to tell you, in Tanzania we produce issue, we have a little wine when you get tired. I know you have coffee, but the coffee from Tanzania is better than this one. Okay, maybe let's take time to make introduction. We will start from here.
Thank you, Excellence. My name is Paul McLean. Thank you. My name is Dr. Michael. I work with Thank you, Excellence. My name is Dr. Mark Mayana. I work actually here in Mvuto at Village Healthcare. I'm an internist here. Yes.
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 Your Excellency, my name is Dr. Alex Magesa. I'm the Director for Diagnostic Services within the Ministry of Health, also a neurologist.
My name is Monica Kess. I'm working with Benjamin Mvuto Hospital. I'm a Director of Research and Training.
My name is Judy Kuroda from United Republic of Tanzania, Ministry of Foreign Affairs and East African Relations. Thank you.
Where we have successfully transplanted 10 children. All of them are Tanzanians, but they are doing very well. 6 of them have been declared cured. They have been cured of the disease. They no longer have the sickle cell disease. So, and this service, we also started it in collaboration with experts from Italy, who helped us train our experts. But now, they trained our experts trained in Italy, but later the Italians also were coming at the hospital. We started with them together. But currently, the services are being offered by our own experts. We no longer again rely on the expert from Italy. So this is also an important information I thought if we share with you. Probably this problem is also there. Maybe we hear from the people, the doctors when they feel. We might not have the statistics, but we are quite sure because of the intermarriages and the mixing as East Africans. Probably the disease is becoming more prevalent than it used to be before. So this is another service which I thought I would share with you to know that the services are already available in East Africa. And just to let you know, Your Excellency, for African countries, our center is the 6th. We have been having only 5 centers in Africa, and none in East and Central Africa. So our center is the first in East and Central Africa to offer these services. Other countries, they are Northern Africa countries, West Africa and South Africa. So East and Central Africa is the first country to offer these services. So, and this is the service which the second part, as the director from the East African Secretariat mentioned, that one of our objectives of coming here is also to do a country consultation, because we want to make a center of excellence for the region for the bone marrow transplant and the mathematical sciences, to be based at Benjamin Mkapa, because we have already started the service, as I mentioned, as I explained earlier. So we want now to help the rest, or to strengthen it, to serve the purpose or the need of the entire East African region. That's why that's another second purpose of our visit here. So to come and consult the expert, to give us more inputs on how we can make it better to serve the entire region, not only for Tanzania, but we want to be a center of the region, so that we can help all citizens who are suffering from sickle cell and other hematological diseases. So that's another reason we thought we should come and get some input from experts. So that's the second service. The third service which we offer, the super specialty service, is cardiovascular services. We offer the interventional cardiology, meaning that we have a cath lab at the hospital where you can do some interventional cardiology, or you can do some cardiology interventions like diagnosing heart diseases using the lab, especially patients whose blood vessels, coronary blood vessels, they have disease, maybe they are blocked, they are narrow. So with the cath lab, we can easily diagnose the disease, but also we can treat patients who have been diagnosed to have heart blood vessels problem, like the coronary artery stenosis and something like that, where we can put a stent. So we have this service also started in 2019, and we have got over 1,000 patients who have been exposed or diagnosed or saved by the lab, and some of them they've been treated by putting stents, and others by putting pacemaker, so you can put pacemaker in the lab, but also we have treated many children who were born with congenital heart defects through closing the defects without opening the chest. It means that it's an intervention which goes through big blood vessels, will access the heart, and they will treat the disease condition without opening the chest. So it's also a service which I'm quite sure they are rare in our region. I know some countries are also doing, but it's important also to inform you that at Benjamin Mkapa we have those services, and well-trained experts they are offering the services. But on top of that, for patients who cannot be treated in a cath lab, we do open heart surgery. We do both for adults and for children. We have done over 30 cases, both children and adults, on open heart surgery. Both adults with heart problems, probably from post-rheumatoid diseases and other conditions which really necessitated to do open heart surgery. So just to tell you that heart services, cardiovascular services are also available at our center, well-trained experts with high-tech equipment, including the cath lab, as I said, well-equipped theaters, as I said. So it's also another service which I would like to share with you, that you should be aware of the service which is available in the Roma Benjamin Mkapa, that if there's the need of bringing patient, it's better to bring them there rather than taking a long journey to India where you spend a lot of money. And for us, when the cost is not that as much as in India. Another service which I would like to share with you is the orthopedic services, especially on the hip and the knee replacement surgeries. We also conduct hip and the knee replacement surgeries at our center. We have done over 150 patients so far, and the outcome is excellent. Almost all of those ones who came at our center and got operated during the follow-up period, they're all doing well. So the outcome is excellent, and I know it's another service which most hospitals have not started offering, but at our hospital we are currently doing that. We also have neurosurgery services, doing brain surgeries for cancer and other conditions, traumas, and something like that. So it's another service which I would like to share with you, that if there is a need of sharing this expertise with your experts in your country, or it's sharing or bringing over patients for treatment, we are ready to collaborate with your country in order to help our people in Burundi and the Tanzanians to make sure that we improve their quality services. Maybe another, okay, that is just a piece of information I wanted to share, apart from many other things, but because of time, I wouldn't like to take much of your time. But as we have started this link, maybe we can continue sharing whatever we are doing there, and we see how we can work together and help our citizens. So the last thing before showing you the little video you have is we thought probably if we can hook up with the experts from Burundi, and we see like which disease conditions are really troubling our citizens, we can see how we can work together and help each other in managing them. And we are planning probably when we go back, we arrange an outreach service. We can arrange and come do some screening and work together, screen some patients. Probably that one to start with is going to be on our own cost. Come and identify, you can help us identify one of the hospitals.
Is to show you how the proposed centers will develop linkages with the existing centers of excellence. And also the area of training, we've heard there about the training that the training can offer. They can offer training to our students, people of East Africa, and this will assist us in implementation of common market protocol when we're talking about free movement of people, free movement of labor, free movement of capital, and rights of establishment, and other rights which prevail. So this will also assist the Center of Excellence, apart from medical treatment, the exchanges, because also there are some areas that the Centers of Excellence will benefit from Republic of Burundi. And you see the language, they speak French, and there is a need of having French spoken in the East African, so that we can have students from, let's say, from Republic of Burundi, from Democratic Republic of Congo. Those are the areas that I think when we finish this visit are the areas that we can develop, they can develop collaborations. And awareness creation, because we also need to do the prevention. So with this, as they say, they'll have some medical camps, maybe here, to create awareness on the services provided, but also to build awareness to people on how they can prevent from, themselves from getting these other, especially regarding the dental. But for those ones who have, they have sickle cell, they can come out, and indicate that they have this problem and see how best they can be treated. So we think once we have these centers of excellence, we'll assist partner states, in these areas. We know each partner state have their own national centers of excellence. But when you talk about the region, about the regional center of excellence, you must have, see how best this regional center of excellence is going to work together with the existing centers of excellence. Like now we have here the Center of Excellence of Nutritional Sciences. Now, Muhimbili or Benjamin Mkapa, they'll know how best, they'll discuss how best they can collaborate in the area of nutrition to prevent or to improve the lives of the people, especially the patients and things like that. Likewise, a day before yesterday we came from the Republic of Rwanda, where when we went to also visit the medical, and that's where they see the equipment, and some areas that they have the equipment, but they need also training. They can send their students to be trained in Rwanda. And these exchanges, and we see free movement, not only of patients, but even the students, free movement of teachers. So at times they can have visiting professors here, or some visiting professors from here to URT, and this is the main purpose, Honorable Chair. So I think after listening to them, maybe they can show quickly clips, because we know
it's very important to invest in that. That you are doing very well as a country, but with this presentation, I can confirm the support of Burundi for the projects. So, thank you. We have learned a lot of these two presentations in the investment made by URT at the two hospitals, Benjamin Mkapa hospitals in the university. But the difference between URT and the Burundi is that the universities are under the Ministry of Education in Burundi. It's the same.
Yes.
Okay, but the School of Dentistry, you said that Benjamin Mkapa is under the Ministry of Health. But you are working in collaboration with the university.
Normally under the Ministry of Education.
Okay.
The hospital is under the Ministry of Health. But the hospital being used as a training or a teaching hospital for the University of